Thank you so much, Skyland Trail, for giving me the opportunity to share my story and also share my experiences of how Skyland Trail made a positive impact in my life and has created so much success in my life so thus far. So with that being said, I'm going to go dive into it. This presentation today is on Come Back to Success and Skyland Trail. Come Back to Success is a book that I'm currently working on, my first publication, as well as just covering the whole what I've learned and how I've been able to get educated on my condition, bipolar disorder, being at Skyland Trail back in 2017. So I'm going to give you guys a little bit of background just so you guys can get to know me a little bit better, and also why I'm credible to talk about mental health and also personal development too, because those two are key to the fundamentals, especially when faced with a mental health condition like bipolar disorder, understanding the two and being able to create results. So like I said earlier, I was diagnosed with bipolar disorder at the age of 19. I'm currently 24 years old. I've been hospitalized in the psychiatric hospital. I have an AA degree in arts and science with business classes. And then I'm just gonna, I'm in the process of publishing my new book, Come Back to Success. So far that's been a great journey and a good opportunity to just share ideas out there related to personal development and mental health. To start, 5 years ago, I studied abroad in Barcelona, Spain. I was self-admitted. I returned home feeling the now what feelings that crept inside my mind. So if you can imagine returning home from studying abroad and trying to decide what do you want to do with your life? What direction? What do I go to school? Do I go to work? What do I do? And I just was like, oh, I don't know what to do. So after 6 months of being depressed and with no end in sight, I was self-admitted into the hospital for the first time in spring of 2016. Life was a struggle as I felt like I had no direction. Flash forward to 2017, I went to the hospital and then went to live in a halfway house. This was hard because the loneliness was starting to get to me. This leads to my experience at Skyland Trail in the fall of 2017. And for those that don't know, as Shannon said, Skyland Trail is an inpatient and outpatient program for ages 14 and up, and it's based in Atlanta, Georgia. And Skyland Trail impacted my life in many ways. And to start with, I came to Skyland Trail uneducated and not motivated to listen to the mental health professionals regarding my mental health. Number two, I was lost and confused about the direction that my life was going. Number three, I struggled to understand more about my mental health and how to manage bipolar disorder. Number four, after going through the program at Skyland Trail, I learned some lifelong tools that I can use to help positively impact my life and impact the lives of my fellow peers who are dealing with a mental health condition, similar or bipolar disorder. And number five, the tools that I learned about was how to develop a care plan and understand what you need to do to stay in a happy and healthy lifestyle. Number six, I also learned how to better understand when any mental health challenge is present and how to react by taking action to better improve my mental state. Skyland Trail can be a transformative place where you can gain insight about your mental health condition and move on with your life so that you can live your best life. After going to Skyland Trail, I had a relapse and ended up in the hospital during fall of 2018. This experience was filled with more challenge and adversity, resulting in a more transformative experience as I learned personal development skills and to embrace my diagnosis fully. There's a term out there that I like to call it, it's pretty popular out there, it's called radical acceptance. And once you radically accept your diagnosis, you can really create monumental change and development within yourself, and also with understanding and accepting where you're at in life. And then the past 5 years of struggle and adversity were the keys to success. The book, Come Back to Success, has given me a sense of purpose and direction as I continue my journey in Southern California. I gain strength knowing that my story and all the content that is in the book can help someone else as they go through their own journey of life, regardless if you have a mental health condition or not. I wanted to focus on the main ideas that I believe will have a transformative effect on the lives of mental health professionals, students, and those that live with a mental illness. To start with, I interviewed Dr. Gregory Jantz and got some great responses related to the mental health professionals and students for perspective. To give you some background information around Dr. Jantz, he's the founder of the Center, A Place of Hope in Edmonds, Washington. Dr. Jantz wrote Healing Depression for Life, which I read, and it's a good book. And it focuses on self-care and a how-to on battling against depression, anxiety, substance abuse, and mental health difficulties. Depression is something that a large population of the world experiences during their lifetime. The ideas that Dr. Jantz introduces in his book, Healing Depression for Life, emphasizes how important self-care is to be successful in an ever-changing, fast-paced world. I asked, for those that are pursuing med school or any type of higher education, what can students do to make a positive change as they gain more knowledge, experience, and expertise in the mental health industry? His response was, themes through the book, Healing Depression for Life. Great opportunity to spread the words of hope, plan for people's wellness by asking for help and getting good care we can help encourage. I went further in depth related to mental health and how students can impact the medical field. For those in higher education, what is the best piece of advice you could give students to help achieve results that will be long-lasting for achieving mental health goals? Dr. Jantz's response was, a lot of opportunities in the field of mental health. Be encouraged about the future opportunity. You are needed. And then I asked, what are the biggest struggles that the world is facing right now related to mental health? And Dr. Jantz's response was, due to the pandemic, depression and anxiety, and the World Health Organization says that depression is a worldwide problem. Dr. Jantz. The next person I interviewed is Amber Gear, who is a grad student at Northwest University in Kirkland, Washington. And I asked, you mentioned that you are going to school for counseling. How can counseling add value to someone who is struggling with their mental health? Amber's response was, added support to the client's support system. There are some clients who come in with no support system. Counseling is part of the management of your symptoms. Counseling is not for everybody. What works best for you and your life. Finding what works best for you and your mental illness. And I think that's really key right there, because when she says finding what works best for you and your mental illness, it's something that I can relate to, because being bipolar, you have to understand that there's certain things that you have to manage and focus on to create stability and a sustainable long-term way of living life that's going to create results and resiliency, especially when you're going through the ups and downs of life, which anybody can go through. And having a mental health condition just makes it more tricky. On another note, after interviewing Zach Garner, licensed professional counselor at Skyland Trail, for the book Come Back to Success, he made a great point about inclusivity for society to destigmatize mental health. I asked, as we look forward into the future, how can we as a community learn to grow and create more acceptance of others with a mental health diagnosis? And Zach's response was, this is a great question with many possible answers depending on whom you ask. I maintain that building awareness through education and training is going to be the best way to increase people's knowledge of mental health. With education comes understanding, and with understanding, the hope would be that acceptance would follow. I think there have been efforts made, and there's much more that needs to be done. It will not be an easy task, and it will mean getting support from community and government leaders at varying levels of influence. In my book, I say, the idea that I want to challenge you to understand is that there is nothing stopping you from what you can accomplish but yourself. And the next part is really important that I really want to emphasize, because for anyone out there that is just trying to find a direction, hope, resiliency, and success, underneath it all, way before bipolar disorder, I knew that I wanted to be great at something, or telling myself that I have something within myself that is worth living for. Whether it is spending time practicing to be the best soccer player in the state of Washington, or just I knew deep down that there was something special that I had that nobody could take away from myself besides myself. On another note, some ideas for overcoming your mental health struggles. Number 1, reach out to someone who can understand you and your struggles. Number 2, give yourself space and time to understand yourself more so that you can be at peace and happy like you were born to be. Number 3, Skyland Trail is a great place to find direction to gain knowledge about your diagnosis. The better you understand your diagnosis, the more successful you will become in managing your condition. I found that God has helped me in my times of trouble and need when it felt like there was nobody around to pick me up. Lastly, believe in yourself. Go get it. Go do it. Thank you.